So complex regional pain syndrome is a syndrome which is associated with a chronic pain in the extremities after a history of trauma. Now, what are the changes that we observe in this? So after a pathology of a trauma, there will be uh, this mainly includes the subchondral bone, which will show osteoporotic changes, and this mainly happens because of involvement of any nerve which is supplying to that region. Now, this happens with an obvious nerve injury, which we can see on imaging, or without an obvious injury, which we cannot see on imaging. If we can see a proper nerve which is damaged, then we call it as causalgia. If we don't see a proper nerve which is damaged, but the distribution of this is along one of the nerves, for example, it can be along the involvement of the radial nerve, it can be along the distribution of the ulnar nerve. So based on this, we will name it as, either it is named as causalgia when the nerve is involved and we can see that nerve involvement, and when the nerve is involved but we cannot see that nerve injury, but we can see the changes along that territory, we call it as reflex sympathetic dysplasia. Now what we see is, we see like this, the area subchondral area involvement, and there will be osteoporotic changes. In this image we can see that this is the pathology which is responsible for this complex regional pain syndrome. That is, there was a fracture, patellar fracture, which has led into subchondral osteoporosis in this patient. Now this is an patient whom there was a twisting injury in the ankle, but the bone appears normal, there is no fracture, the density of the bone appears normal. 3 months later, a oblique radiograph of the ankle of the same patient shows that there is some osteoporotic changes in the metatarsal base, as well as in the lateral cuneiform bone. We can see some osteoporotic changes. This is because of the reflex sympathetic dysplasia after twisting injury of the ankle. The same patient, when a lateral radiograph is taken, we can see the talar head is also showing some osteoporotic changes. This patient also presented with chronic pain in the foot and ankle post twisting injury after 3 months. So this is how complex regional pain syndrome will present in the patients who have some trauma or some pathology in the past.